treatment of in-hospital pediatric cardiac arrest with pulses VTAC or VFib. Essentially, that there was. It's very important to read this because it says that lidocaine use was independently associated with improved ROSC at 24 hours survival, so better than lidocaine for pediatrics. Amiodarone was not associated with superior rates of ROSC or survival at 24 hours, but neither drug was associated with survival to hospital discharge. So, again, are these drugs even necessary? The debate continues, but they're basically saying that lidocaine can be used as well and maybe even better for ROSC and 24-hour survival. And that's now a class 2B recommendation. Okay, almost done. The oxygen issue, very, very important. We're going to beat this one to death. So let me just skip through here. We have the studies in neonates for a long time showing that if you resuscitate neonates with oxygen, their mortality skyrockets, okay, almost doubles. That's in neonates. In cardiac arrest, this is a slide from Mike McAvoy, who started a study in Germany on adults. Room air, a cardiac arrest on room air versus NFI2 of 100%, and they stopped the study in its tracks because the people who were getting 100% oxygen with resuscitation were dying at an alarming rate. So here's a cool slide of someone getting their heart catheterized, and you can see here that on room air the coronaries look nice and open, and at 100% oxygen the coronaries squeeze down, and so this is a normal healthy patient. So that's important information to know. So what does PAL say? The word is now normoxia. After ROSC, essentially they're saying less than 100%, so your patient should never be at 100%, but they should be 94% or greater when you're able to wean those patients off. So again, the word normoxia doesn't mean 100% anymore. It means while I'm talking about O2, I'll talk about end-tidal CO2. They basically say in the guidelines, don't go less than 30 for end-tidal and don't go greater than 50. This is all post-arrest. This is PALS. This is ACLS. Same thing. So you want to stay between 30 and 50. They talk about post-arrest fluids and vasoactive drips. So and I quote, after ROSC, we recommend that parenteral fluids, so IV fluids, and or inotropes and vasoactive drugs be used to maintain a systolic blood pressure greater than 5th percentile for age at the bottom of your book. When it shows you vital signs, you can see that first systolic blood pressure is at the 5th percentile for age. So that's kind of the marker you want to go to for that patient. Okay, and we're almost up. So the targeted temperature management, so temperature control in pediatric patients. We all know what the TTM trial did for the adults. So let me skip through here. But in pediatric studies showing benefit. So here's what they recommended. This is straight from the guidelines. And they had a differentiation between pediatric out of hospital versus in hospital. So for out of hospital cardiac arrest, interesting, they say for infants and children remaining comatose after out of hospital cardiac arrest, it is reasonable to either maintain 5 days of continuous normothermia, so TTM, so not going down, or 2 days of initial continuous hypothermia, followed by 3 days of continuous normothermia. And I just thought that was very, very interesting that they give you an either one to choose from. So that'll be hospital dependent. For in-hospital cardiac arrest, they say there is insufficient evidence to recommend cooling over normothermia. So basically, if you have a cardiac arrest in the hospital, they're just going to treat your temperature, but they're not going to cool you. Very interesting. Okay. For those of you who are sticking around, I appreciate it, and I'm going a few minutes over. I want to go now into the mobile and really show you what we've done the demo. And for those of you who don't, either you can give us a call if you're interested, or the mobile is going to be available more than likely by December 1st. That's our target date. Here's North Memorial, who is going to be beta testing our mobile. So all the medications you see here are from Minnesota, and essentially how it's going to start is as soon as you open your iPhone, your iPad, or even your Toughbook, which is not going to be the first thing we're going to have. That's going to be another build, but